Pratna will give the vote of thanks. Okay?
Yes, sir.
Okay,
Yes, sir.
Yes, sir.
Did you inform all these things? Sierra Rice, both the batches?
Yes,
Yes.
sir. It has been, sir.
Okay, fine. Just follow it up. Huh? We'll start
Okay.
in another. I told Om Prakash also, he'll be there in another 10 minutes.
Okay, sir.
Good morning, sir.
Hello, Lalita. Can you hear me well?
Yes, sir. We can hear you.
Good morning, sir.
All right. Yeah. How are you?
Good morning, sir.
Morning, sir.
Hello.
So we are all PG students, sir.
All right. So it's morning over there, right?
Yes, sir. It's
And
10:20
you know-
so time.
Yeah, it's early morning here. It's like 2:30 a.m. in the morning.
Yes, sir.
Yeah, so it's a big time difference. It's around 8 and 8:15, I think.
Okay, sir.
Good morning, OP.
Good morning, sir. How are you?
Oh, fine, fine. Thank you. How are you, OP?
I'm good. Thank you, sir.
Wait, let me switch on my video.
Okay, sir. How are you, sir? Namaskar.
Namaskar, OP.
It's been a long time, sir.
Long time. After a long time, we are meeting online, OP.
Yes,
Very
sir.
very nice to see you, OP.
Yeah, same here, sir.
Then how are things there?
Things are good. Things are going in a positive direction, although it takes time. And but yeah, I'm moving through my target. So things are going good and going as expected. So
Very
so
good.
far so good.
Very good, OP. Keep up the positive vibes and God will bless you. Don't worry, OP. I know you are a very hardworking person.
Oh, thank you, sir. Thank you so much.
I still remember Anup Soni's words. I am a weak candidate, OP. You are a strong candidate.
Yeah, you remember that thing.
That was what should I say? Dialogue of one of the
Century.
best part of my life while teaching students.
Oh, sir. Yeah, totally agree.
No, I very well know you, OP. I know you are a very hardworking person, so you will get it. Don't worry. Whatever you have wished for, you will complete your DDS, and very soon you will be moving in a right positive direction.
Thank you, sir. Thank you so much. I can share my presentation.
Another 3-4 minutes,
Should I wait?
OP. Another 3-4 minutes.
Okay.
Because we had given them a time of 10:30, 10:25 onwards. So we'll wait for another 4-5 minutes. It's just 10:22.
So how is the weather over there? Is it still
it's
warm?
very, no, it's getting hot, OP. Temperature right now is around 32, 33. Slowly it is picking up. It will go up to 35, 36 peak summer, May.
Wow.
How is
Here
the
people can
temperature
only
there?
wish about that.
No. How is the temperature there?
Oh, here right now it's -3, but
Oh.
mostly it's like -10 to -1 or even 0 during the summertime. Here there is no summer actually, particularly where I am living in St. John's. So here we say cold, colder, coldest. There is no summer. There is no concept of summer.
Oh, you are living in a
So-
different planet, OP.
Yeah, it's very isolated. It's a remote island in Canada, and even in the different part of Canada, we can expect some summer, and there is a clear weather. Like summer is summer, winter is winter. But here in St. John's, it's just a desire.
Oh, it's
So
just
there is
winter
no
and only
clear cut
winter.
summer.
It is just only winter and winter and only winter.
Winter, winter, and winter.
Oh,
Yeah. So yeah, but still we do not have that temperature fluctuation like in if you go further north. You will get more temperature fluctuation, means it will go to -30, sometimes go -45, but here it doesn't go more than -10, -15 is the maximum because of the ocean. So we do not have that extreme temperature, but still
okay.
it's very unpredictable.
How close are you to the Arctic pole?
So it's like we are living in the coastal area, so it's like Atlantic Ocean is nearby. So that's why temperature fluctuation is not that much, but still it's like always windy and foggy and cloudy. So temperature is like that only, sir, here.
You come towards Greenland. I mean, Greenland is close to you.
Yes, yeah, Greenland, and then if we go straight, we can hit London from here.
Okay.
So it's just like the eastmost corner of Canada.
Kavya.
Sir, good morning, sir.
Good morning, Kavya. So I think shall we start? It's 10:25.
Yes, sir, we can go ahead, sir.
Okay, then you start, Kavya.
Yes, sir. A very lovely morning to one and all present here. As a part of the public health dentistry family of Vivekananda Dental College for Women, it gives me boundless pleasure to welcome you all to our virtual CDE program. Before we continue, I would like to express our gratitude to our beloved Dean Sir, Captain Dr. Gokulnathan Sir, our Principal, Dr. Balan Sir, our Head of the Department, Dr. Girish R. Shavi Sir, our esteemed Speaker of the Day, Dr. Om Prakash Yadav Sir, Head of all the other departments, beloved faculty members, postgraduates, and interns for gracing us with your presence today. I request all the participants to kindly mute yourself and help us in conducting the program smoothly. You are welcome to post your queries in the chat box and they'll be addressed at the end of the session. On to the program now. I call upon Dr. Girish R. Shavi, Head of the Department of Public Health Dentistry, in welcoming our speaker. Thank you.
Thank you, Kavya.
Thank you,
Now
sir.
I would like to, good morning, everybody. Now I would like to introduce this thing. My head of my esteemed, one of my PG students, Dr. Om Prakash Yadav. He'll be speaking on opportunities and challenges for dentistry in North America available as of today. So, okay, fine. He has done his Bachelor of Dental Surgery from Vyas Dental College and Hospital, Jodhpur in the year 2010. And then he went on to do his Master of Dental Surgery in Public Health Dentistry from Rajasthan Dental College in the year and completed in the year July 2015. And then he worked in Government Virology Center in Jodhpur for 3 to 4 years as a scientist. And after that, he proceeded on to do his Master of Science in Medicine Community Health from Memorial University of Newfoundland, St. John's, Canada. So that he completed in the year of 2021, that is last year. And currently he's working as a research assistant at St. John's, Newfoundland, as a research assistant in the dermatology department. And also he has worked as a research assistant in the Division of Community Health and Humanities Faculty of Medicine at the St. John's University, Newfoundland. And also he has worked as a lecturer in Department of Public Health Dentistry in Rajasthan Dental College in India. And also he has received various awards as Fellow of School of Graduate Studies Award from the University of Newfoundland, and Aldrich Wova Leaderboard Award, Best Presentation Award in 22nd Aldrich Interdisciplinary Conference at University of Newfoundland, Medal of Merit Award for the Best Presentation at UNESCO Award in the year 2020, Best Research Training Award valued at $6,000 in the MITAX, the Shri Muley Community Health Graduate Student Award valued at $6,000 in the year 2020, Outstanding Dentist Award from the IDA in the year 2018, as well as in the year 2017 from Rajasthan, India. And his various awards and publications are available even on the World Health Organization website. And apart from this, he's very good in epidemiological studies. And to his credit, he has got a lot of international publications as well as domestic publications. And his professional memberships include, he's a committee member of the Canadian Association of Physicians for the Environment, Newfoundland and Labrador. He's a life member of Indian Association of Public Health Dentistry, India. He is a student member of the Canadian Association of Public Health Dentistry, Canada. And he's senior editor and consultant biostatistician in the International Healthcare Research Journal, India. And he's a manuscript reviewer for BMC Oral Health, Journal of Dental Health, Oral Disorders and Therapy, and Journal of Cancer Research and Therapeutics. So to his credit, he's got immense knowledge in the field and is working very hard to become a renowned epidemiologist and a biostatistician. And he's also working his goal towards achieving his licensing in the dentistry in Canada. So I wish him all the best. Now I proceed on to the speaker of the day, Dr. Om Prakash Yadav, to deliver the lecture. Thank you.
Thank you so much, sir, for your lovely introduction. And I would like to thank you all the organizing committee members, chairman, and dean sir for inviting me for this presentation. So let's be started. Just I'm sharing my screen. So can you see my screen now?
Yes, sir. Please. Yeah.
Okay, so let's get started. So the title of today's presentation is Challenges and Opportunities in Dentistry in North America. So the first question arises, why to practice in dentistry in North America? So the first question arises, why to practice dentistry in North America? Even if we want to see, even if we want to think about that, like we want to go outside the country. So the first question our relatives or our family members may ask, why you want to go? What is there? So first we need to explore what are the possibilities in North America, what we can gain. So we can discuss some points about that. So what are the points? So here we can see there are shortage of dentists. We can see there are overall demand of dentists in at least in couple of decades. And then increased population diversity is also one of the factors which can, attract foreign trained dentists or foreign educated dentists in North America. So other factors which can, consider our decision to come to Canada or US can be a better work-life balance. And then, of course, a job stability is there. So in job stability in terms of private practicing and working in a hospital, both options are available. and it is considered one of the good opportunities here. We can still get the very good experience and good experiences in with different clinicians, and there is always a scope for continuing learning experience with continuing dental education and contemporary educations. So these are the factors, but the most important factor would be being a dentist is financially rewarding over here. So we need to look into all the things into consideration and decide what we want, why we want to move out. So after that, if you can see in this table, there is a inflow of dentists from 2015 to 2020. So we can see the majority of the people who move is under the age of 35 and 34 to 44. But even all the age group people move through this time period. Even we can see that people from age 55, age 65, even the age 75 and 85 moved during that time period. So you can take your decision anytime. Better is sooner, but there is no age for the moving out. So there are some terms and things which we will encounter while doing our search for dentistry in US or dentistry in Canada. So the first term is foreign educated dentist or foreign trained dentist. So every time when we will search about the dental programs and dental admissions, so we need to be very clear like why we are a foreign trained dentist or educated dentist. So according to American Dental Association, an individual who has attended, graduated, or earned a dental degree from a dental school in a country other than United States or Canada is considered as foreign educated dentist or foreign trained dentist. So after that, there is also a term regarding the NDEB and NDBE. So we always confuse about what is NDEB and NDBE. So these both the terms are different. So NDEB is used for National Dental Examination Board of Canada. This is an organization responsible for establishing and maintenance a national standard of competence in Canada. So this is a national dental board and which conducts all the examination, which conduct all the screening of documents. So everything is done by NDEB. So this is the National Board of Canada. So second term is NBDE. So what is that? So the national, this is called the National Board Dental Examination. So this is the name of the examination which is there in United States. So conduct the examination for students or professional in dentistry. So the next question will arise, how to become eligible practice in North America. So we solved the first problem, why to move out. Now the second question will be, what are the things which make me eligible for the North American dentistry? So the overview could be first, education requirement. Of course, we need to clear the education requirement. We need to prove that we got the dental education, dental degree. So that will be verified with different agencies. So the first option will be, or the first step would be education requirement and credential assessment. The second will be, we need to go through different examinations. So there will be written examinations we need to clear, and after the all written examinations, then we have to go through the clinical steps like clinical procedures and bench examinations. So after clearing bench examinations, then we can go through the interview phase. So these are the basic 4 steps which we need to encounter before getting dental license or dental degree in North America. So first we will discuss about the dental procedures or getting dental degree or dental license in Canada, and after that we will discuss about the United States. So if you can see in this picture, this is a broad overview of all the things which are there in Canada. So here we can start from the equivalency process. So what is equivalency process? It is nothing but just getting our degrees validated clear some exams, and then we can get direct license for dentistry. We can practice dentistry without any additional degrees. So there are some steps. First, of course, we need to clear the paperwork. We need to assess our documents. We need to get our documents assessed by Canadian board. So after that, we need to give the AFK, that is assessment of fundamental knowledge exam, followed by ACJ, assessment of clinical judgment exam, and then there was an exam ACS, but now it converts to NDECC. So this is National Dental Examination of Clinical Competence. So these are a list of exams which we need to clear. After that, we need to go through the written examination of dental board, and then only we can get the dental license. So this is the first step, and this is the easiest step through which we can get the dental license in Canada. So what is the second step? So second step would be through the getting the dental degree here in Canada. So what are the steps for that? First, of course, we need to clear the documentation process, paperwork. We need to assess our documents here by the Canadian board. After that, we need to give the AFK exam. So as you can see, AFK exam is common in equivalency process as well as in advanced placement. So we need to clear the AFK exam, that is called assessment of fundamental knowledge. So this exam assess our basic fundamental knowledge regarding dentistry and biomedical sciences. So after clearing this exam, actually we have two options. First option, we can either go to equivalency process directly, or we can stay in the advanced placement or international foreign dentist degree program. So in that, we need to apply for dental education, dental schools. So in Canada, overall, there are 10 dental schools. So 2 dental schools are for French speakers. So after that, we have only 8 dental schools here. So apart from 8, one dental school, that is University of British Columbia, they are not taking international students currently. So we have only 7 options here in Canada for the dental admission for the DDS degree. So we can apply based on our AFK score. So previously what happened, there was requirement of getting the highest score in AFK. Usually it should be around 85 or more than 85 percentile to get the invitation letter from the different schools. But now, since last year, they changed the scoring criteria. They changed the percentage system. So now what they are doing, they will only give you a pass or fail designation, and even the universities or schools, they will not also be able to access your percentile. So this is just a pass fail system now. So actually they are adopting the North American, or we could specifically say American pattern. So in that, we need to create a holistic profile. We need to create a balance in our profile, such as we need to go for research activities also, we need to do volunteering also, and we need to get our degree, of course. So with combination of these all, then only a school can assess and send us an invitation for the admission. So these all things matters now. Previously, it was only an exam game. Like you just clear the exam, get a high score, and universities will invite you, and then you can go through the process. So the now process is changed. So I would say it is it is in some way it is good, but it is subjective. But I personally feel this is really good for the candidates, because we still, after getting the score, we have other things to prove that we have a holistic profile and better candidate for the DDS degree. So after that, we need to give the bench exam. If we universities or schools give us acceptance, then we need to clear the bench exam and interview, and follow that we can get admission into DDS program. We need to clear DDS exam, and then for the dental board exam, that we need to give for even after the DDS degree. So this is all about the advanced placement program. So there are some other programs such as specialty pathway. So that is for the specialists who are a specialist in India and in any other country. So if we already have a specialty degree, then instead of going for the bachelor program, we even have an option of going directly into a specialty program, but this program is very competitive and the seats are very limited. So you know, but even we have option, and if somebody wants to go directly in specialty, they can apply for this. So the first step is to clear the dental specialty core knowledge exam. So we need to clear this exam, and then there are different schools which have dental specialty assessment and training program for different specialties. So we can apply in that universities. We can get our residency in 1 year. So after that, we can get the dental license, specialty license in Canada. There is one another route which is not so popular, but there is still a way to get into it and get the dental licenses. We can clear the we can apply in universities for different masters program. They are clinical masters program in dental specialties, and if a supervisor accept someone for the program, then we can enroll in the program, we can complete the program, and even after that we can get the dental license. So let's see what is about the dental degree accreditations. So another term which we encounter and we always see, like, is our degree accredited or not accredited, and what is the proper accreditation. So countries recognized by Commission on Dental Accreditation of Canada, that is CDAC, and American Dental Association's Commission on Dental Accreditation, or CODA. So they recognized the degrees from Australia, Canada, Ireland, New Zealand, and USA. So these are considered accredited dental degrees. Apart from that, all the dental degrees, including general dentistry, specialty, are considered non-accredited dental degrees. Am I going little fast? Hello?
No, sir.
It's fine. It's
Is it
fine.
okay?
Yeah, it's okay.
Yeah. So now there are some steps to get the license in Canada. So as we discussed the overview, so now we will go into the step by step. What are the things we can go? So first we need to set the target where we want to go, because the procedure are totally different in Canada and US. So we cannot aim both the things together. So we need to set our target. And before discussing all the things, there is an important thing to discuss about the PR process. So you need to be sure about your permanent residency in Canada, because without that you cannot practice dentistry even if you get the license done. But permanent residency is requirement to start the practice or do the practice. So the first step would be creating your profile for National Dental Board for your document assessment. So this is very simple. There is a good video. I shared the link for that. So you can go through the video. It's a very simple process. We need to just follow the pattern prescribed by the dental board. We need to get our transcripts. Actually, here we call transcripts, but in India, I'm not sure about the Tamil Nadu, but in Rajasthan, if you say I need transcript, they will give you a summary of your mark sheets, and that is not they are looking for. So basically, they look for a verified mark sheet, like your score should be there, all the subjects should be there. So they need that. And if you say transcript, so I experienced that, like we need to sure we are getting the right document, because if you get the transcript, which is the summary, like some place they consider summary of all your mark sheets, so that they will not accept, and then you need to send it again. So be sure you need to send your verified mark sheet when they ask transcripts. So along with your transcripts, previously they were just asking transcript from the universities and some paper, but now they changed their pattern. So now they are asking your original degree along with your original internship completion certificate and some paper form, so which needs to be filled by the applicant as well as university. So after assessment, they will send your original documents back. So overall, they say it takes 18 weeks for the document to be assessed, but with my experience, I'm telling you, it may take 6 months, it may take 7 months, even it takes years. I know people who are still waiting, and they applied like 1 year before, 2 years before. So it's a very complex process. So it's better if you are thinking about going Canada and practicing there and clear exams. So this is the first step. We need to start as early as possible. So we need to send the right document on right time, and then we will get our original document back. So approximately they say it's 18 weeks, maybe 18 to 20 weeks or 25. But this is only a tentative thing. And for the written documents also, they say it's 10 to 12 weeks. So it may change according to the situation or personal documentation process. So this is the first step we need to clear. Then again, as I discussed earlier, there are two important pathways to get the dental degree or dental license. So the first is equivalency process. So in that, it is very simple. We need to clear, it's not that simple, but I'm telling you in way of understanding. It's simple, like just need to clear 3 exams and get the dental license done. And the second step is we need to clear first exam, that is assessment of fundamental knowledge, and then we can apply in dental schools. After applications, a dental school may reject your applications, may accept your application. If our application is strong enough and the dental school send us invite, so we need to clear the bench examination. And after the bench examinations, we need to go through an interview process. And then if everything is all right and university accept us as a candidate for DDS degree, then we can enroll in DDS program. So nowadays, again, rules are changing. So two dental schools, one is University of Toronto and one is University of McGill. So they now change their pattern. So now they are not following AFK. Now they are considering A-DATE, that is Advanced Dental Application Test. So now they are asking students to apply for A-DATE, Advanced DATE, and then they will consider their applications. So no more AFK into another dental schools. So it's like day by day the rules are changing. So just wanted to update you regarding that. So just clear the A-DATE exam and then we are eligible to apply for admission in 2 schools, University of Toronto and University of McGill. Apart from the these 2 universities, the other universities still considering AFK exam for the screening criteria. So now we'll discuss about the AFK exam. What is the AFK exam? So this is the first dental exam we need to clear in any condition, even if you want to go for the equivalency, even if you want to go for the dental degree program. So first exam, 200 questions, multiple choice questions, 2 hours, as simple. And then there is no negative marking. We need to, like, they will assess the biomedical knowledge and applied clinical science knowledge. So the passing criteria is 75 percentile, and they set the percentile according to the difficulty level. So paper format is previously it was based on the paper format, but now because of the COVID situations they are conducting AFK exam through electronically also. And even after, like, even inside the Canada, they are considering the centers outside Canada, such as in US cities and then Australia and New Zealand as well. So competition is really high nowadays here. So people are so desperate, like sometimes it's very challenging to get the center, because the exam is only twice in a year. First the exam will be in February, and then the second exam will be in August. So we have only 2 options in a year to give the exam, and at a time exam seats are fixed. So if we want to apply, it's just like hitting and trial basis. If you are lucky enough and if you get the seat for the exam, then you can appear for the exam. Otherwise you need to wait for another term for the appearing in the exam. So this is strange, but this is the truth. So we need to be very clear, we need to be active. If you are in the market and if they open the exam for the applications, then it may be problematic. Although they mention well before, like when they will open the applications for the program, but still it may create a lot of trouble, and sometimes students are not able to get the right center. So you need to go outside then only you can give exam at your time, otherwise you need to wait for another term. So this is strange, but this is the truth for this exam. So only twice in a year, and competition is there even to appear for the exam. Forget about the pass and fail. So this is the first exam. So I'm not discouraging anyone, but I'm telling the truth what is there. And so the second exam is assessment of clinical judgment. So after passing the first exam, as we discussed earlier, we have two options. So the second exam will give us eligibility for getting near to our dental license. So this exam will be of 5.5 hours examination with a 30-minute scheduled break, and then the questions will be from anywhere from 120 to 150. Multiple choice questions will be there, no negative marking, percentile is 75. So all things are like same. So the questions will be from case-based diagnosis, treatment planning, clinical decision making questions, and radiograph interpretations. So this is a clinical judgment exam, and this is the second exam we need to clear to get our dental license in Canada. So this is also done electronically at different prometric centers in Canada and New Zealand. So the third exam is assessment of clinical skill. So now they convert the exam into the different exams. So now it is considered as NDECC, so National Dental Examination of Clinical Competence. So this is the third exam. It's a 2-day exam. So first we need to perform the 12 dental procedures on simulated mannequins or patients in clinical setting, previously administered at Faculty of Dentistry in Canada and New Zealand, but now they change it to and the center in Ottawa. There is only one center in Ottawa. The good thing is that they make unlimited options, unlimited attempts for this exam within a 5-year window time. The bad thing is that now we need to clear all the skills. Previously, one skill, if you are not able to clear out of 12, still you can go through the exam. But now you have to clear all the 12 skills in order to pass. So this is in both ways. So this is all about the second exam. So what we will be done like 2 days. So the first day there will be a clinical skill exam. So we need to perform different preparations, different clinical procedures such as amalgam preparations, class 1, class 2, composite restorations, composite fillings, and then crown preparations, temporary provision, temporary restorations, and endodontic cavity preparation as well. So these skills will be there for the clinical skill exam. And the second day, sorry. Okay, so second day there will be a situation judgment exam. So in that they assess our situational judgment, like what we will do or what we can do in different situations. So this component assess judgment required for solving problems in work related situations. So these are the two components for this third exam. So after clearing all 3 exams, now we need to go again for 2 exams. So the first exam would be the NDEB written examination, and then the second exam will be objective structured clinical examination. So these 2 exams are common for everyone, like the student who started their dental degree from first year onwards, they also needs to clear this exam. And even for the foreign educated dentists or foreign trained dentists who are coming directly into second or third year of dentistry, so they also needs to clear the exam. So this exam is common for everyone, even for direct licensing, even for the degree program holders. So what is NDEB written examination? So this is basic, this exam assess the basic knowledge of clinical science and applied clinical science and judgment. So 2 150-minute sessions administered in the morning and afternoon of 1 day. Examination contains 300 multiple type questions, and then again 75 percentile is required to pass. 3 attempts are there. Finally, you need to clear objective structured clinical examination in order to get your license. So it assesses your clinical judgment, includes diagnosis, treatment planning, prognosis, treatment methods, clinical decision making. So 2 sessions administered on the same day. Each session will include 50 MCQs and one constructor response questions. So constructor response question is means they may ask you about the questions which is like open-ended or essay type question. So we need to respond that also. So we need to review the information provided by such as case history, case chart, photographs, radiographs, and then we need to respond accordingly according to the questions. So again, 75 percentile is the passing criteria, and then 3 attempts are there. So this is all about the OSCE exam. So after clearing all these exams, then we can get the NDB certificate for practicing dentistry in Canada. So granted upon successful completion of written examination and OSCE exam, then we can get the proof of graduation from National Dental Board. So when you are certified, your name will be entered in National Register, and you will be mailed a hard copy of your certificate, and certificate does not expire. So after that, it depends. There is one more step which involve before you start practicing. So there are many provinces here, just like states. So in which state or province you want to practice, you need to consult the local dental regulatory authority, and then they may ask you for different documentations and jurisprudence test or evidence of language before they grant you the license. So this is the final stage before getting the dental practice here in Canada. So this is all about the different exams which we can clear and get the license directly. And this is the second step. Like if we are already specialist and we want to do specialty practice directly instead of going for the direct licensing or the bachelor degree, we can start dental specialty program also. So the first exam we need to encounter is dental specialty core knowledge exam. This is highly competitive, very limited seats, but still we have an option. So again, at the time of document screening, we need to specify we are applying for screening only for our bachelor degree or our bachelor degree and master degree both. Because if you only assess your documents for bachelor's program, then again you need to send your documents for screening for a specialty program. So if someone is willing for directly going in dental specialty program, so what they can do, they can send all their documents all together to National Dental Board so that they can assess and they can grant you access for both the examinations. So after that, you can give both the exams or any exam of your choice. So applying in this exam, applying for the screening is little expensive. For the basic screening, it takes around $800 to $1,000. But for screening of dental specialty program, so screening of documents I'm talking about. So screening of documents for this dental specialty program takes around $3,000. So it is expensive, but we can bypass all the steps which we need to follow through the documentation process. We can send all the documents all together at a time, and then everything is done all together. So first exam, we need to clear dental specialty core knowledge exam. So people may ask question. So I am in public health dentistry. What will be the exam pattern? I am in oral surgery. What will be the exam pattern? Someone say from perio, someone say from prosto. So the strange thing here, but this is true. There is a common exam for all the candidates. There is no special exam for specialty. This is called specialty program and specialty exam, but there is no specialty exam for individual specialty or specialization. So there is a common exam. Everyone needs to clear the same exam, and then they can apply in their specialty. So even after clearing the dental specialty core knowledge exam, then we have an option to apply in dental schools in different dental specialty assessment and training program. So these dental specialty assessment training program are also very limited and competitive, because the local students who are doing bachelor degree or also in competition. So this is like really competitive, and very few seats available for the international trained dentist, but still options are available, so we can apply. So there are limited universities which offer the dental specialty assessment. So there are only 4 universities. Basically, they offer the specialty assessment and training program. So we can go and get our specialty degree, and then we can practice specializations in Canada. So the first exam, DESCI or Dental Specialty Core Knowledge exam. So consists of combination of 95 to 100 questions, multiple type questions, 3 hours of time, and then format is electronic. We can give exam at Prometric Center in Canada, and questions may include radiographic images, photographs of models, or photographs of patients, or patient's case history if applicable. 3 attempts are there. So after passing the dental core knowledge exam, then we have option to apply in University of Alberta in orthodontics, University of British Columbia in 8 specialty. Unfortunately, they don't offer public health dentistry. In Dalhousie University, we can only apply for oral and maxillofacial surgery, and University of Toronto accepts all 9 specialty admissions. So this is all about the universities which accept the dental specialty training program. So after clearing the dental specialty training, which is of 1 year, we can apply for directly for National Dental Specialty Examination. So individuals who have completed a specialty program is recognized by the Canadian Dental Commission. So test entry level competencies required for dental specialty, cover general specialty knowledge including basic science, clinical diagnosis, and treatment planning. NDS is 1-day examination administered electronically, and there are 3 parts of this exam. So what they assess your policy analysis skills, your data analysis skills, and mix of single and multiple choice questions with constructor response questions as well. So these are the 3 parts for specialty examination. So after clearing the dental core exam, we need to go through the specialty assessment program of 1 year, and after passing that, we need to go for this examination in order to get the license done. So these are some study resources or documents which we can find easily on National Dental Board of Canada's website. So what are the materials available, and what are the materials we need to refer when we are applying for the exam. So release questions are there on the website, and then different questions for AFK exam, ACJ exams are there on the website. So we can go through the past year questions. We can see what is the pattern, how the questions is being asked, so we can prepare ourselves. So these all study material is available on the dental board website. We can go through in the study resources, and we can access all these materials, and even they provide the video for the electronic examination orientation as well. So apart from that, we can always refer dental books for study material, reference books, and apart from reference books, there are coaching centers which offers services. So we can even go to dental coaching centers. The most popular one is Prep Doctors and Confidentist. So these are the 2 most popular coaching centers which provide services, and the cost of one-time coaching would be around $4,500 to $5,000 for assessment of fundamental knowledge exam, and then it varies for clinical assessment and clinical judgment. So for clinical judgment, it may be around 8,000 something, and for the skill, it may go up to $9,000. So it may vary from a different type of exam. So but still options are available for coaching. And then dental dex is there. Particularly dental dex is used for a clearing exam for United States, but still we can refer the dental dex and mastery app to enhance our knowledge for the exam. So this is the most important thing. First, before considering everything, we need to see what would be the cost and what would be the expenditure. Can we afford that? So this is the most important thing we need to take into consideration. So as I discussed earlier, for equivalency process, the process will be fast and it will be less expensive, no doubt about it. So but still we need to spend at least 15 to 20,000 or 30,000 Canadian dollars. So it may vary, it may be, you know, more, it may be less. It will be not less than 15,000, of course, because you need to give examination fees, and you need to spend time for your preparation and everything. So somewhere around 15 to 30,000 it will take for your direct equivalency process. What about the advanced placement? So for the advanced placement, the cost will be more high. So it includes the all the examination fees, coaching fees, and then your relocation, location, and, you know, going through the traveling. Apart from that, you need to you need to pay for the tuition fee for the schools. So this is like, you know, vary from somewhere around 60,000 Canadian dollar to 100,000 Canadian dollar per year. So total cost would be around 150 to 250K for going for the dental placement or dental degree examination, like directly getting the dental degree instead of getting the license. So the process is costly compared to the equivalency process, and it takes more time, because it takes most of the schools provide 3 years of dental education. Some school provide 2 years of dental education for getting the dental degree. So after the, you know, discussion about the Canadian dental education and exams and criterias, now we can discuss about the process in United States of America. So what are the steps in US? So there are different exams and different process, of course. So we can go step by step and discuss about the process. So the first step, of course, this is applicable for everywhere or all the things. Research thoroughly about DDS and DMD programs and requirements. This needs to be done for Canadian perspective as well. So we need to do a good research. I'm talking about why I'm talking about this research thoroughly here, because in Canada there are only as I discussed 10 dental schools and 2 are in French, so 8 schools. One is not accepting, so only 7 schools are there. So it's very easy to know the criteria and regulations and requirements for 7 dental schools. But what about US? So there are around 70 dental schools in US, and all the schools have different criteria and regulations and requirements. So it's very complex, cumbersome process to know criteria of all the dental schools. So that's why the first step should be research thoroughly about the DDS or DMD program and requirements. So the second step would be ECE or WES evaluation. So now we will compare the things with the Canadian perspective so that we can understand better. So in Canada, we need to apply directly in dental board for our credential evaluation. Here in United States, they say we need to go through the third party organizations such as education credential evaluation or World Education Services evaluation criteria. So we need to send our documents to these organizations. They will assess and they will validate our degrees, and then we can apply for further examination or steps. So the good thing about the US is that this process is very simple compared to Canadian credential assessment process, which is very complex and very time taking and very costly. Here in US, the process is very simple. You need to send your all original documents to these agencies. They will verify it within 7 to 10 days and then send your documents back, and everything is done. So very simple, straightforward. They just ask original documents. They don't ask transcripts, verified mark sheets, nothing. So this is simple and easy. So I like this process. And the third step is prepare the integrated National Dental Board examinations. So maybe we are familiar with the 2 exams. Previously, it was part 1 and part 2 dental board examinations. We used to say this is part 1, this is part 2. So now they join together both the exams. So now there will be only one exam, that is called integrated National Dental Board examination. So we need to clear this exam to get the admission in dental schools. So again, I remind you one more thing. So there is no concept of direct licensing in United States as it is available in Canada. So we need to go through the process for the DDS degree. We need to get the degree and then we can practice dentistry. Even though there are different other processes, like you can go in specialty program, general dentistry certification process, and even in selected province we can practice. But this is the most important, or I would say majority of the people choose this because it provides a lot of flexibility, and seats are more, and it's easy to get into it. So we need to clear the only one exam, integrated national dental board exam, and then we are eligible. See how many exams were there in Canada. So apart from three exams, AFK, ACJ, and ACS, and then we need to go through the national board examination and OSCE. So here only one exam we need to clear, and then we can get our dent pin. So as soon as we need to just apply for American Dental Association website to generate our dent pin. So as soon as we open the dent pin, we can schedule our registration for the INBD. So first we need to prepare for the INBD. So I would suggest INBD we can prepare at home also. There is no such requirement to get a coaching or special services for clearing this exam. This exam is way simpler than the Canadian exam. So even if you study seriously for 2 to 3 months, you can easily clear this exam, and there is only pass and fail system. There is no percentage and anything related that. So we need to just clear the exam. It's very simple. This exam is common for every student, like the person who is doing 4 year of dental education, so they also needs to clear this exam. And for the foreign trained dentist who wants to do the international trained dental program, so they can also do the same thing. So this exam is common for everyone, so we need to clear this exam. It's very simpler, easy, and it doesn't require special services like coaching or these things. So this is important. So take the INBD at prometric centers in US and Canada. So unfortunately it's only available in North America. So if somebody is outside the America, then you need to come here and then give the exam. So this is it takes time, and it costs a lot to go for your examination and give the exam. So but this is how it works. So exam is prometric centers in US and Canada, and then take the TOEFL examination. So this is for the English assessment. So TOEFL is a requirement for almost all the dental schools in US, and there are different expectations from different schools. I would say it starts from 75 to 110. So basically most of the dental schools expect you to get a score of more than 100, because it's always encouraged to get high score to be in the preferred list. And then based on this is an important criteria, like getting a good score in TOEFL is always better to get a higher chance of acceptance. So we need to go through the TOEFL examinations also, and then apply for universities for DDS or DMD programs through CAPID application. So after passing your TOEFL exam, you are all set to apply for your CAPID applications. Okay, so what is CAPID application? So this is a centralized application for advanced placement of international dentists. So this is run by American Dental Education Association. So this is, we usually call it ADA CAPID. So ADA CAPID is application service through which we can apply for dental schools. So this is a centralized system. We can apply all the schools through this same portal. So in Canada, we need to apply individually in different schools according to the criteria. Here we can apply from a single portal for all schools. And the interesting thing, in the single portal, if you go through this portal, even though if you do not have dental exam or TOEFL examination, you can create your ID anytime. And then in the last section, program material, you will have a dictionary, and in that directory you will get that requirement of all the dental schools in a same portal or in a same page. Like you need to click on the dental school and you will get the requirements, how much TOEFL score is required, what are the other requirements for passing, is A-date, advanced date is is a requirement or not. So these all things you can assess in a single portal, even if you do not clear the exam or other requirements. Anyone can create a ID, and then you can good to go and explore all the things. So I would encourage you to, open, create ID in Capit, and at least go through the process and see how many dental schools are there and what are their criteria. So you will be familiar with that. So that will really help to apply, because you cannot apply in 70 dental schools because it's really costly, and it's not practically, because it requires time, resource, and fees also. So we need to select dental schools according to our requirement, and uh, where we are easily have a good fit for the school. So we need to see all the criteria and apply accordingly. So what are the tips for successful application? So apply in a timely manner is must, because it's a time bound thing. The application usually start in March, and then it go up up to sometimes in September, December. So some dental schools even accept the applications again till late Feb, just like University of Colorado. And but for the Boston University, they only accept application until August. So it varies from different university to university. The Capit cycle starts from March and it go further. So we should apply in a timely manner, then compose a strong personal statement. So in Canada, there is no such concept of nowadays. They are saying like we need to create a holistic profile, but before that there was no concept of collecting all these documents. You can directly get a good high score in AFK, and then university will give you acceptance. You need to clear bench and interview and all set. But here you need to provide a holistic profile. So a good personal statement is a must. If we write a personal statement which is not strong enough, so the dental schools will not consider for the invitation. So strong personal statement, sometimes people take help from the professional writers to write their personal statements, because sometimes we know we have done a lot of things but we are not able to express ourselves in a proper way. So this could be a big factor for acceptance or rejection. So report all information including test scores and results and every academic institutions attended. Like we need to add all the information in the Capit profile. We need not to skip anything. As much things we can add, that is good, because they need a holistic profile, a balanced profile. Sometimes people ask, who is the best candidate, a fresh graduate or a experienced person? So it's totally vary from university to university, and screening team, like what they think, because they look for the balance in the class, like balance in the batch. Once they will start taking the applications and selecting students, they will consider all the things, like the batch should not be from a one geographical area. So they will select the student from different geographic area locations, so in order to maintain the ethnicity balance. Apart from that, they need to see how many fresh graduates are there, how many experience are there. So they try to adjust all the factors and make a balance in the batch, so that they have all that kind of students. So it's not about like fresh graduates cannot apply. They are also encouraged to apply, and sometimes they also get the chance to admission prefer to experienced persons. And they say like experience, I got 4 years of experience, I got 10 years of experience, even though they are rejecting my application. And I know a person who is just recently graduated, he got accepted. So it varies. And because they just want to make balance their batch. And so everybody is encouraged to apply, and everybody have a chance to get accepted. So apart from that, there are keep contact information updated. There are some information in Capit which are we can update later also after submitting our profile. So this is a good thing. Like in Canada, once you send your application to dental school, it's done. Forget about everything now. So if you get a recent achievement or a recent credential or anything which can boost your profile, so in US there are some information which we can update later also, and universities can always look for your updated information. So this is a good thing. So after applying Capit, what next? So wait for the interview. So if we get the invitation for the interview, this is well and good. Then we need to, prepare for the interview and bench test. So simultaneously, before getting the before some schools, conduct the directly interview nowadays, especially in COVID time. So, but in majority of the dental schools previously before COVID, I would say around 90% of the schools conduct bench test before interview. So we need to prepare for bench also. Bench test means a clinical test um, performed on mannequins, and we need to perform certain skills such as amalgam preparation, cavity preparation, and restoration, and then crown preparation. So these things we need to perform, and then we can go for interview process. So before COVID, around 90% of the schools, you know, uh, required the criteria for bench test. But during the COVID, many schools, skip that bench test, and they directly, conducted the interview and took the students without bench test. So that was important thing. But now again, they are starting bench test. So this is also one thing we need to take into consideration. So if we are going through the bench process, then again we need to do practice on mannequins and typodont, so that we are familiarized with the process and everything. So, and if we do good in interview and bench test, then all set, we can get a high chance to get accepted from the school. So if we get acceptance from the school, then they will this is the most important thing now in US. So after clearing all the steps, which are like smooth and easy compared to Canadian regulations, so this is the most important step now, collecting funds, because US is very expensive. It's deadly. It's like you need to spend around 150,000 to $250,000 for tuition fee only. Forget about the living expenses, they are extra. So it depends again in private to public institutions and different university to university, and depend on the cities also. So but somewhere around 150 to $250,000 US dollars we need to keep in mind for the tuition fee, and other expenses are extra, so we need to take care of these things also. So apart from that, there are options available. For people ask how I will arrange the finances for dental school in US. So there are many options for us, particularly from outside North America. And if we do not have any connection, or if we do not have any relative, or I would say cosigner, it's difficult to get a loan from federal banks. Still, there are chances if we can find a cosigner, even the cosigner is not a relative, they can cosign, but it's a big responsibility and nobody wants to do that. But even if we can get a cosigner, we can get loan from federal bank, and then it's very easy and simple. If we are not able to get the finances or loan from bank, then we need to arrange from ourselves, like from our country we need to get the abroad education loan, or we need to arrange somewhere with something else. So even there are some private banks which offer loan, but the interest rate is really high. It's like 14% around, and it's a compound interest over them. So it's really expensive if you spend around $250,000. So we need to be, make sure how we are arranging our funds. So before going all this process, we need to be sure, are we able to afford this or not? So this is also important. So after that, immigration is also one of the criteria. So in Canada, you cannot practice without PR. Here in US, you need to have a work visa and student visa. For study, you need a student visa and work visa for working there. So, but still there are certain dental schools which only provide admission to, they say it's preferable to Canadian citizen or green card holders. So the chances of getting admission for international students are very less in that schools, and but most of the schools are open to international students. And so some schools arrange student visa related things by themselves, and they arrange everything. Some school says you need to arrange yourself. So then we need to arrange visa process. So we need to get visa to get admission. So for exam, we can go with travel visa, right? But with for study, we need to get student visa. So going for exam or for travel visa is okay. We can go there, we can give exam, and then we can come back. For study, we need to go for student visa. So after that, if we get the DDS or DMD degree, then take the state license, provincial state license, and then we can start practicing in US. So this is how it works in US. So basically, overall, there are three important things in US. So first, as we discussed, the advanced standing program or the DDS program. So this is the most simpler and easy to go into it. So this is a bridge course making international dentist equivalent to US trained dentist. We have to, go for 2 years of dental education and we can get the dental degree. Apart from that, we still have option for dental residency programs and advanced postgraduate education programs. So for dental residency programs, provides education and training in specific subjects such as specialty we are doing in India. So these are the specialty programs. We can directly go into the programs, although the programs are competitive and limited seats are there, but still we have a chance. And even if we get the admission, we can do specialty practice. Again, there is a limitation for that. The certification is only limited to certain provinces or states, so we cannot practice around the like all over the states in United States. We need to practice in selected provinces. So that is one of the limitations, but still we can do the specialty practice if someone wants to do that. So, and one more thing is about advanced postgraduate dental education program. So this consists of two programs basically. So general practice residency and advanced education, general dentistry practice. So this is apart from the 9 specialty, they also provide certificate course in different other related dental specialties such as anesthesiology or oral medicine or facial pain. So this is typically GPR is typically conducted in hospital setting, such and the AGA program is typically conducted by the universities. So there is a specific portal, such as there was a portal for ADA CAPIT. So there is a specific portal for ADA Pass for the specialty program. So if we want to go for dental specialty programs, then we need to apply through this portal. So the portals are same, conducted by same organization. So this is for exclusively for residency program or specialty programs. So application benefits by being able to complete one standardized application rather than individual applications, such as in Canada, you need to go in individual schools and apply. Here there is a centralized process. So all applications can go through one portal. So applications usually start for specialization in May and closes in February. So this is just a tentative dates. It may change, according to the time and conditions. So what are the limitations? As I discussed earlier, license to practice is limited to few states. It is difficult to get used to, into the US schools because we need to compete with the other DDS degree holders. And then there is no stipend, unfortunately, for international students. Such as, for the regular DDS candidates, which come through the, dental degree program, they can get the stipend from different universities. But for the internationally trained residents, which they want to practice directly, we do not have any option for salary or stipend, so we need to spend money here also. So this is an overview of all the steps in US. It's very easy compared to Canadian steps. So first we need to, like, we are a foreign trained dentist, so what we need to do, we have 3 options: advanced standing or direct DDS admission, and then specialty training and advanced postgraduate program. So for specialty training and advanced postgraduate program, we will get the certificate and we can practice. And with the advanced studying program, we can get the degree and then we can also practice. So everything have their own advantage and disadvantages, but still, things are there and options are here. So okay, now we discuss everything about the steps, procedures, regulations, and criterias and everything. I know it may be, seems complex when you are like going through the first time all the steps, and it takes time to understand individual steps. But still, you will have a, a overview. You will have a rough idea of what are the things and what are the options available. But before thinking about all the positive aspects, we need to think about the limitations or challenges. I was discussing with Dr. Girish regarding that. So it's not about only the things which we see, the good salary, better work-life balance, and better opportunities, good clinical experience. They are there, but still there are some limitations. So what are the limitations? So this is a very good article which I found. So this explains, the challenges about for the dental, foreign trained dentists. So, I summarize all the things in four headings. So the first can be stringent admission process. So we know, the process is very simple compared to Canadian process, but still there are certain things we need to take care of. Like we need to make our profile, we need to make personal statements, go through the bench exams, interviews, different type of interviews. Somewhere they conduct one-to-one interviews, sometimes they conduct group interviews, sometimes they conduct multiple mini interviews. So things are not easy, but it's complex, and different specialty and many schools are there. So we need to be very careful about the regulations of all the schools. So sometimes the admission process seems stringent. And then expenses, of course, we need to take care of this cost and finances. So this is really really expensive, and we need to be financially sound, and we need to be make ourselves stable regarding the financial situation, how we will make our funds for living expenses as well as dental education. Because during your dental educations we are not supposed to work outside, because we do not get that much of time. I got many of my friends who are working in US as a dentist, and many friends who just got accepted in US schools and even in Canada. So I'm in touch with them. So it's not about the like you will. They have a very tight schedule of all classes, and course curriculum is very high. So you will not get time for the part-time things, like you can earn money outside. And it's not allowed also in US to work part-time based on your visa requirements. So it depends like which type of visa you have. So again, it's very difficult to arrange and manage funds in US. In Canada, you can in some extent you can do part-time, but still it's not advisable to do part-time during your dental education, because you need to do your best, get your degree and do good practice. So you need to spend money over it. So finance is a big thing we need to take care. And then cultural differences, of course, in Canada it's the most culturally diverse community here. So expectations are there, but it's sometimes challenging to go through the uh, different cultural things, and understand different culture and become familiar ourselves to according to the current or local culture. So this is also be a challenging thing. So this is applicable for both US and Canada. And then immigration, so this is also important as finances. So in Canada, I am repeatedly saying we cannot practice without PR. We should have PR in order to practice. But in US, we can go on a work permit, we can do practice. Still, if we have green card or citizenship, it's a very high chance to get accepted by the schools. If we do not, the competition is really high, because it's not about only like the people are applying from Asia or South Asia. People are applying from different countries, like all around the globe. So we have like a big competition from all over the students from all over the world. So it's really challenging. If we have some extra things like immigration, if we have some support in US, like let's say someone have relatives, or so at least they can arrange their living expenses, and they can arrange their accommodation. So this is a big help, and you can prepare here sometimes for dental schools, they require local shadowing, local dental practitioners support letter. So how you will arrange all these things? So sometimes immigration, makes a big difference. So we need to take care of this also. Immigration is a big key. So apart from these challenges, let's discuss about something about saturation. We usually discuss saturation in India. So what about the saturation in North America? So there are contradictory statements. Some says it's not saturated, it will not. Some says it may, and some say it will saturate until after a decade, after 5 years. So there are contradictory things, but I just found one report from Canadian Dental Association. So they speak about the oversaturation of dentists in Canada. So they says there is a growing per capita pool of dentists in particular jurisdictions, particularly in urban areas like Toronto, Montreal, and Vancouver. And I'm living in Canada right now, so I know situation is not that good, which was before. It's we are going through the going towards the phase of oversaturation, or I would say saturation. Still, the freshly graduates prefer to go in remote areas here in Canada to practice. They are not preferring practicing in city areas because the competition is high over there. So people are started moving in remote areas. So we need to take care of this also. Like if we move, if we do all hard work, and then again we encounter these kind of problems. So we need to be very careful about that. So I'm not discouraging anyone, but we need to know all the aspects so that we can take a good decision, because this is a big decision. We need to require a lot of commitment and time and expenses. So it should be taken carefully. So I was just going through the one another article which was written by Professor Mansky. He is a professor in dental public health in University of Maryland. So what he says, according to one article, he says around 168,000 full-time dentists in 2040, and which indicates 32 to 110% saturation or surplus. So this is alarming actually. We never know what will happen in the future, but these are the trends which shows like we are going towards the saturation or oversaturation phase. But even the same times, this is with the COVID situation. So is there anything which will affect the dentist future or career because of the COVID-19 pandemic? So he says there will be no such consequences, and the future of dentists will remain bright and good even after the COVID pandemic. So all the mixed opinions are there. So we need to take decision according to our considerations and careful examination of all the aspects. But these are the things which I just wanted to inform you based on my experiences and based on my current knowledge here. So I'm just leaving you from this picture at this picture. So I just came through, and this we can consider is a good also and a bad also. Good in terms of people are getting treatment at home, and bad also like are we really going towards the saturation? So I'm not criticizing anything, but it is started. So people are going at home for scaling or dental treatments. Basically not dentist but dental hygienist started. So but this shows the local trends. And so this is all about I wanted to share with you all about the challenges and opportunities of dentistry in North America. Thank you so much for your listening, and your questions, comments, feedback are more than welcome. You can contact me anytime. And I would like to thank Dr. Girish for inviting me and providing me this opportunity. Thank you so much.
Thank you, sir. Thank you for your enlightening lecture, sir.
OP, that was very nice of you for having given such an elaborate lecture and opened our eyes for the future students of Canada and United States. I think after listening to this, most of them would have decided whether to go or not to go.
Of course, we should know both the things, just like fluoride. It's a double-edged sword.
Yes,
So
yes,
we-
yeah, exactly. Okay, just like fluoride, it's a double-edged sword. Even the same thing applies to this also, because it's
Yes.
a very elaborate process. But they should have a fire in their belly. Only then it's possible, OP.
Of course, sir.
See, that I can see in you. So if people have that fire in their belly, then definitely they can make it. There is nothing that which can stop them.
Of course, nobody can stop.
And that is why these people have made it, so competitive that they want only the best.
They are making the regulations and policies so stringent and complex, and making it like filter criteria is very hard. But still, people are coming, students are coming. It's not like students are not coming. They are coming every day, and that's why people are so desperate. Once I mentioned about the challenges getting into, like, appearing in the exam itself. I'm not talking about passing or failing. I'm talking about getting into the exam itself. Like, if you are not getting a chance to appear in the exam, they are going outside the country. They are going Australia, New Zealand for the exam. So this is how this shows like competition is increasing.
Correct.
And we should know all the aspects.
OP, there are two questions for you. One
Yes,
is
sir.
that is there any age limit for getting into abroad dental programs?
Oh, there is no age limit as such, as I know. There is
Yeah.
no age limit. No,
Yes,
there
that is
no
true.
age
There is no
limit.
age limit. There is no age
Yeah.
limit.
And they
And,
encourage all the people. Sometimes they encourage to apply for higher age group also, because they think we can utilize this person in different way. So their
Yeah.
thought process is different. They don't think
Yeah.
like this is old and this will be of no use. They can
Yeah,
think
correct.
like this may be productive in different ways. So
Correct.
I don't think age is a criteria.
Yeah. And one more question was, is there any opportunity in India after an abroad degree?
In India, if you get a degree from US or Canada, and then if you go back, as per my understanding, there we can definitely we can go for advancement in treatment process. We can learn here advanced treatment, contemporary treatment procedures, so we can implement that. So that is a good perspective. But apart from that, from academic side, I don't find anything specific like but for the clinical side, we can definitely improve our skills. And but there is a lot of investment here, and if we are doing investment here and then going back, so it's a big decision. And it requires, like, because these are not funded programs, just like research based programs which are funded and we can do on funding. So this, like, we need to pay, and then if we are paying it, then we expect to have some returns. So it's not feasible. But even if people wants to do, they are more than welcome, and they can definitely, I would suggest they do advanced dental education in certain specialties, such as like implantology or some endodontic complex process, so they can learn these things, and then they can go back and then start practicing there. So then definitely they can help community as well, and they can do good practice also. So it's on both sides.
Yeah, that's what. Thanks, OP, for the lovely lecture. Okay, so thanks for your guidance. If there are any questions, you can email Dr. Om Prakash Yadav on his email ID and get answers to your questions. He's very forthcoming in giving you the right direction. So thank you, Om Prakash. Thanks a lot. Now I ask Dr. Pratna to give the vote of thanks.
Thank you, sir. Thank you so much.
Thank you, sir. Before that, I request Dr. Shanmati to post on the certificate. Thank you for your wonderful lecture, sir.
This is your certificate. I will send you the certificate in the physical form also.
Thank you, sir. Thank you so much. Appreciate it.
Thank you, sir. It was a very nice presentation, sir, Dr. Lolita. Actually, we felt as if we are in Canada and US You have given us the full picture. Thanks a lot, sir.
Of course, yeah. Thank you, Lalita. And if we come here, then only we know the actual picture, what is going here, and things which are unknown from other part of the country. So yeah, and I'm happy to share all my knowledge and information. Thank you.
That was very informative, sir. Thanks a lot. Good day.
Yeah, thank you so much. Thank you, everyone.
Thank you, sir. I thank everyone and for giving me this opportunity. And I extend my gratitude for Jarman sir, Dean sir, Dr. Gokulnathan sir, Principal sir Balan sir, and our beloved head of the department, Dr. Giri sir. And I'd like to thank our chief guest, Chief of the Honor, Dr. Om Prakash Yadav sir, for this inspirational thoughts, and we guided into a new vista. And I'd like to thank all the staff members, participants, and the students for being there with patience. And I hope we all have acquired and inspired by your knowledge. Thank you all for this great opportunity. Thank you, sir.
Yeah, thank you, everyone.
Thank you, OP. Bye-bye and take care.
Yeah, thank you. Have a good day. Thank you.
Good day, sir. Thank you.